You're watching a CBS 42 News at 6 special, COVID-19 Now.
And tonight, the state of Alabama is leading the nation with the highest COVID positivity rate and the lowest vaccination rate. Good evening. I'm Art Franklin.
I'm Sherry Jackson. This is a special edition of our CBS 42 News at 6 o'clock, specifically COVID-19 right now. Tonight, we're looking into what is fueling the COVID-19 pandemic in our state. Here's what's on agenda tonight: Delta variant, debunking misinformation, vaccinations, schools, and COVID-19. And tonight we'll be getting answers from a panel of experts, including State Health Officer Dr. Scott Harris.
We also have from UAB Infectious Disease Department, Dr. Michael Saag, and we like to say good evening to both of you guys. We're going to be talking to you gentlemen in just a second. But first, we want to get to the start of the COVID-19 in Alabama right now. We've recorded 592,417, that is, total coronavirus cases since the start of the pandemic in March of 2020, and 11,542 people have died. Right now, health experts are treating 1,694 COVID-19 patients in hospitals across the state, and as of today, more than 3.4 million vaccinations have been administered from health experts in the state.
Yeah, Alabama, one of 17 states leading with the vaccinations right now for under 50%. Information from CBS News. That is the alarming part of where we are, how far behind we are in vaccinations.
Alarming indeed. And let's get over to Dr. Harris, our state health officer. Dr. Harris, what do we need to do? We've been trying everything in the state. What do we need to do right now to get people vaccinated?
We need people to understand that this is a race against time. We don't have the luxury of sitting around and trying to make a decision about information that we may get down the road. We have our hospitals that are filling up right now. We're seeing the highest number of cases we've seen in several months. We have vaccine available in well over 1,000 locations. It's free. It's available without an appointment. We need people to make a decision to please go out and get vaccinated as quickly as possible.
We know the governor today, and you were with her, talked about more people showing up to get vaccinated. Has that been because of the clarion call from health professionals about this Delta variant and where we are with infection in the state?
I certainly hope that that's the reason. You know, I do think that when the numbers go up, many people realize that they know someone close to them who's been affected or infected, and people are motivated to sort of overcome that inertia perhaps they've had in making a decision. We had on this past Friday our highest number of first shot vaccinations since we've seen in mid-May, so that's certainly encouraging, but we still have a really long way to go.
Dr. Harris, thank you. I want to get over to Dr. Saag if we can right now. We've been hearing about this new war that we are in right now. Sherry, you want to get from Dr. Saag, what do you think about that? What does this new war on COVID-19 mean to you?
Well, Art, we are dealing with a virus, as we said a second ago, that is much more infectious. Every person who gets infected with this virus will infect 5 other people in the course of their illness, and that is new. So I think what we need to focus on is that front, the front of getting people vaccinated. Unfortunately, there's an awful lot of misinformation out there. So public health officials, we are sort of stuck right now with fighting a two-front war, the virus and misinformation.
And that's part of the reason we are doing this special, to make sure that people can be adequately informed about what's out there. One of them is this alarming new data from the CDC about the 35,000 vaccinated people a week who are coming down with these so-called breakthrough infections. And that's a reminder, though, that's out of 164 million people who are fully vaccinated. And so that's still 0.02%. But the fact that people think they're protected, therefore not wearing masks and potentially spreading this virus, Dr. Saag, can you talk about how even vaccinated people are playing into what's happening in Alabama right now?
Well, let's take a step back, Sherry. What we're dealing with is rapidly accumulating information that's changed our way of thinking about this. And that's what happens when you're in the middle of an infectious disease pandemic. A month ago, I was saying you get vaccinated, it's like wearing a biologic mask. And that was true before there was Delta. And now that Delta's out there, we're seeing that vaccinated people can transmit to others, but this is the key point. While you can get infected, after being fully vaccinated, you're very, very unlikely to get really sick. You're very unlikely to go into the hospital and certainly very unlikely to die. The numbers that we have from the past is that out of all the people who have died in May and June and now so far in July, 99.2% of the deaths are occurring in unvaccinated people. The vaccinated people are protected. That's what we want to take home from all this.
You're speaking about the Delta variant. Let's get back over to Dr. Harris. Certainly concerned about the Delta variant here in Alabama. What is the impact right now of the Delta variant, and what should we be looking at ahead?
As Dr. Saag said, the Delta variant is much more likely to be transmitted from person to person. One of the things that we have seen that we had not really experienced before is that vaccinated people can transmit this disease quite easily, much different than the previous variants we had seen. But really, I think the large number of unvaccinated people is still responsible for the bulk of what we're seeing. You know, we've reached now about 2 million Alabamians with at least their first shot. That's really less than half of the eligible population. We still have a long way to go. With Delta, again, we don't really have the luxury of time. We're seeing our case numbers increase every day. We're seeing our hospital beds fill up every day. We really do need people to get vaccinated as quickly as possible because the vaccine products we have are effective at preventing infection with Delta. They're safe to take, and they're widely available.